From the JAMA Network, this is JAMA Dermatology Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Dermatology.
Hello, and welcome to this author interview from the JAMA Network. This is Dr. Adamson, the web editor for JAMA Dermatology. Atopic dermatitis is a common chronic inflammatory disorder of the skin that is most prevalent in children. It's been associated with sleep disturbances, inattention, and learning disabilities. There have also been some studies linking atopic dermatitis to cognitive dysfunction. In a new study in JAMA Dermatology, authors investigated whether atopic dermatitis was associated with symptoms of cognitive impairment in children using the U.S. National Health Interview Survey data. Dr. Joy Huan is a dermatologist and assistant professor in the Department of Dermatology at Johns Hopkins University School of Medicine in Baltimore, Maryland. She's the senior and corresponding author of this new study and is here to discuss this new work. Welcome to the podcast, Dr. Huan.
Thank you for having me, Dr. Adamson.
All right. So for those in the audience that are unfamiliar with you or your work, do you mind telling us what your role is at Hopkins? I know you do a lot of research. Is that one of your primary focuses? And how do you balance that with seeing patients and the patient populations that you see?
So I am a pediatric dermatologist here at Hopkins, and I care in my clinical practice solely for children and see a lot of children with atopic dermatitis as part of my practice. But my clinic is not limited to just caring for children with atopic dermatitis. I also see a variety of other conditions in pediatric dermatology. And I do spend the vast majority of my time doing research, as you mentioned. I spend probably about 80% of my time doing research. And my research is really focused on understanding kind of the life impacts of chronic skin disease like atopic dermatitis in pediatric populations. So in my research, I use a variety of epidemiologic approaches to examine some of these questions of interest to us. And so this work that hopefully we'll get into the weeds about later on today is one of those things that we've been interested in.
So the association between atopic dermatitis, which can be a really chronic and debilitating disorder, especially when it's very severe, interrupts sleep, etc. There have been previous studies that have looked into the association between this disorder and cognitive function measured in various different fashions. What makes your study specifically a bit newer, or how does it contribute to this space in which we already have some data?
Yeah, that's a great question. So in a nutshell, I think what our study does is adds some nuance to some of the previous findings that have been published. So maybe just to quickly recap what's known to date, prior to this current work. There have been, I would say, about a handful, maybe more than a handful of studies to suggest that children with atopic dermatitis and also some adults with atopic dermatitis may be at greater risk for having cognitive dysfunction. And as you sort of mentioned earlier, cognitive dysfunction has been looked at in a variety of ways using many diverse measures of it. And so there is no one gold standard, right, for measuring cognitive function. And so in the previous studies that have been done, people have measured cognition using a variety of tools. Some have been questionnaires asking about symptoms of essentially attention deficit hyperactivity disorder, or ADHD. Others have used patient-reported outcomes that ask a variety of questions that surround kind of self-reported cognitive function. Some other studies have looked at diagnoses of conditions such as learning disability or ADHD and have used those as proxy measures for cognitive dysfunction. So basically in the previous literature, there's been just a variety of ways that cognition has been measured as an outcome. And one can argue about the pros and cons of these various methods. And then also beyond those previous outcomes that have been examined, the populations that have been examined in previous studies have also been quite mixed. Some have used more population level data. Others have used more clinic-based populations. So by that, I mean they are giving out questionnaires to people who are coming in to see a dermatologist, for example. And so there are some potential biases, including, lack of generalizability, right, of some of the findings. And so our intent in doing this study was to try to use more population-based level data and to also examine cognition using a couple of questions directly asking caregivers of children with atopic dermatitis about symptoms of potential cognitive dysfunction.
So you were really interested in a large database looking at basically the general population. So you decided on the US National Health Interview Survey. Would you mind telling the audience that's not necessarily familiar with this database, who does it sample from, and what were the specific questions that were asked in order to identify who had atopic dermatitis so that you could study that specific population?
Yeah. So the National Health Interview Survey, which I'm just going to refer to as the NHIS going forward, is a large representative sort of sample of US households. And so these studies are actually done on a continuous basis and are overseen by the US CDC. And the data are actually publicly available. The intent of these NHIS studies is to essentially sort of get the pulse of health conditions of the nation. And so from any year to the next, they may ask about different health conditions that are thought to be affecting the American population. And so atopic dermatitis is one of the conditions that has been asked about on this NHIS survey at various time points over the years. And then from year to year, depending on kind of the priorities of the survey designers and interest in various health conditions at that time, the questions may vary from each year's administration to the next. So how the NHIS works is that what they do is they choose a sample of US households that is meant to represent the sociodemographic characteristics of the overall US population. And then for the pediatric component of the survey, what they do is among those random samples of US households, they then randomly select, if there is one, a child per surveyed household for whom questions are then asked to a parent or adult caregiver about that child and his or her or their health. And so the point of the sampling design, which I've simplified in my explanation, the point of the sample design is to capture essentially a representative sample of the US population as a whole. So a lot of the data that come out of the NHIS are used to derive prevalence estimates for how common a disease or uncommon a disease might be across the US population and such. And so atopic dermatitis, as I mentioned earlier, is one of the conditions that has been asked about on the NHIS survey at multiple times over the last 10 plus years or so. And some of our population-based estimates for how common atopic dermatitis is among children in the US come from the NHIS survey and some other related CDC-administered national surveys as well. Now, in our study, we used just the data from the 2021 version of the NHIS, and this was because during that year's administration of the survey, they did ask about atopic dermatitis, but it was also one of the first times where they asked the parents or caregivers of the children sampled whether they had any symptoms of learning or memory impairment or difficulties. And so this was one of the only years of the NHIS survey that would allow us to look at those two variables together. And so just to answer your question about how atopic dermatitis is assessed as part of the NHIS, what is asked of the parent or the caregiver is a question of whether the child has an itchy rash due to quote unquote eczema or atopic dermatitis, or have you ever been told by a doctor or other health professional that your child had eczema or atopic dermatitis. So it is a fairly specific terminology that is used to ask the parents or caregivers about whether the child has a diagnosis or known rash that fits with atopic dermatitis.
And the association that you were worried about was learning and memory symptoms, correct?
That's correct, yes.
And that was assessed using the question compared with children of the same age, does the child have difficulty learning or difficulty remembering things?
That's correct.
And so you had this question where you're able to characterize pediatric patients as having atopic dermatitis or not. And then you also had a question of whether those children had learning or memory difficulties, and you wanted to see whether there was an association between these learning and memory difficulties and having atopic dermatitis, correct?
That's correct. That was the first question. And then we delved into it a little bit deeper beyond that by trying to get into nuance a little bit, perhaps identifying the subgroups of children with atopic dermatitis that may be at greater risk than other subgroups of children with atopic dermatitis for some of these learning or memory impairments, which I think is perhaps the more novel piece beyond what previously has been done.
So, how about you tell us what your overall findings were before you actually looked at subgroups of neurodevelopmental comorbidities or not? Did you actually find an association between learning and memory symptoms and atopic dermatitis? Because this is something that has been found in other studies. Is it something that you also found here?
Yes. So we found an increased rate of parent or caregiver reported difficulties with learning and memory among kids with atopic dermatitis to those without atopic dermatitis. And generally, it was about a twofold increase in the rates of memory and learning difficulties in the children with atopic dermatitis compared to those without. And so that is consistent with some of the previous studies that have also found either memory difficulties or greater rates of learning disability diagnoses or memory difficulties among children with atopic dermatitis. At least we're finding very consistent findings, right, with some of the previous literature. And so when you look at just children with atopic dermatitis as a whole in this NHIS population that we have, compared to those without atopic dermatitis, overall, there was about a 70% increase in the odds that their parent or caregiver would report that they had any sort of difficulty learning or any sort of difficulty remembering.
So, you found this association, which has been found before. So, in some ways, that's probably reassuring
Yes.
that you found the consistency. But then you did something a little bit different where you looked at among pediatric patients that had some neurodevelopmental comorbidities versus those that don't. Do you actually also see this association between learning and memory difficulties and atopic dermatitis? And can you tell the audience your findings there and why you did that?
Yeah. So maybe first it's best to say why we bothered to look, right? So as we were discussing earlier, cognition sort of as an outcome has been looked at in a variety of ways in some of the previous studies. And one of those ways is to use essentially kind of a proxy measure for having cognitive concerns. So people would look at whether kids with atopic dermatitis had greater rates of, say, ADHD or greater rates of learning disability, kind of these diagnoses, right, that might be given to a child at a young age. And so those previous studies found that there was greater rate of ADHD in kids with atopic dermatitis, greater rates of learning disability diagnoses in kids with atopic dermatitis. And so in this study, what we wanted to do was, now that we've understood from a symptom level of whether kids with atopic dermatitis might have more symptoms of memory difficulty or learning difficulty compared to peers without atopic dermatitis, the next question that we had was, well, how does that relate to known neurodevelopmental conditions or diagnoses that may have been given to the children in our population? Because one of the missing pieces to some of the previous studies that we have, or perhaps the unanswered question, is if children with atopic dermatitis have a greater risk of, let's say, cognitive impairment, well, who is it among those children with atopic dermatitis? Is it everybody, or is it select subgroups of children with atopic dermatitis? And so there have been some studies to try to look at atopic dermatitis severity. And for us, because we didn't have data related to atopic dermatitis severity in this data set, we were interested in looking at some of these other potentially comorbid neurodevelopmental conditions among our population to see how that might relate to having more symptoms of cognitive impairment. And so what we did was, because the NHIS survey also asks parents and caregivers whether the child has been diagnosed with ADHD or developmental delay or a learning disability, we were able to kind of parse out those three, what we kind of just called together neurodevelopmental conditions. And so what that allowed us to do was then to stratify or break down our overall analysis into a subgroup of children who have sort of a known neurodevelopmental condition like ADHD, developmental delay, or learning disability, versus a subgroup of children with atopic dermatitis who don't have a neurodevelopmental condition that's already diagnosed. And what we found there was that among the kids without a known neurodevelopmental condition like ADHD or learning disability, for example, there was no major association between having atopic dermatitis and having symptoms of cognitive impairment, which is actually quite reassuring, right? It suggests that perhaps children with atopic dermatitis who don't already have a known learning or attention disorder diagnosis, that they are not necessarily at greater risk for having cognitive impairment. But then within the group of children who do have a known neurodevelopmental condition like ADHD or learning disability, what we found there was that within those children with those conditions, atopic dermatitis was associated still with increased odds of having difficulty learning and particularly difficulty remembering.
Did these results surprise you?
I would say it did not surprise me based on some of the previous literature and some of our other ongoing studies as well. So I'll just briefly mention, we've also been interested in just this overarching topic of atopic dermatitis and its potential impact on cognitive function in children. And so when you look at the study findings in this particular study, also in the context of some of our other ongoing work, which has found that some of the other population-based or large birth cohort data sets that we've had access to, we haven't seen a striking increase in cognitive dysfunction among all comers with atopic dermatitis. So I think what we found here among this group of US-based children, it's sort of similar. It suggests that not everybody with atopic dermatitis is going to have, potential risk for having cognitive impairment just by virtue of having atopic dermatitis compared to the next kid who doesn't, but that among a subgroup of children with atopic dermatitis, these can be more of an issue. And those are probably kids who are coming to the attention of providers for symptoms of, say, ADHD or learning disability, perhaps already.
Do you think there's an opportunity here to focus on this group of individuals that do have a diagnosis of neurodevelopmental difficulties and atopic dermatitis, either in the dermatology office or, say, in the primary care setting? Or is it just too early to make that assessment?
Yeah, I think that there is definitely more work to be done. But I think what we found in this study has helped us to maybe hone in a little bit on perhaps the most at-risk subgroup of children, right, with atopic dermatitis, that we should focus some of those future research and interventional, perhaps, or preventative efforts on down the road. So among kids with atopic dermatitis, for example, just in our NHIS sample, about 11% of them have a known history of ADHD. And
That's a pretty significant number.
exactly. And just also in my own clinical practice, I've also seen that a good number of patients that I care for with atopic dermatitis also have a known, diagnosis of ADHD. And so while we can say perhaps the kids who don't have these known neurodevelopmental conditions are not particularly at risk for cognitive dysfunction, we still have a significant number, right, of kids and patients that we care for who do have comorbid neurodevelopmental conditions and for whom we probably need to do more work or not probably, but we really do need to do more work to understand the mechanisms behind the cognitive symptoms that they might experience, right? And how that relates perhaps to the atopic dermatitis that they have and the control of the skin disease as well. So one of the things that we weren't able to directly look at in this particular NHIS study was the influence of sleep. And we get into it a little bit in our discussion of our findings, because when we take a step back and think about, well, how does atopic dermatitis potentially influence cognitive function? I think one of the really interesting factors to consider is sleep, because we also have other independent studies that have just looked at atopic dermatitis and its relationship to sleep. And we know, and I think most of us who care for individuals with atopic dermatitis can definitely appreciate that having this chronic itchy condition of the skin can lead to a lot of sleep impairment or disturbance. And so how the role of sleep plays into some of the manifestations and symptoms of conditions like ADHD and learning disability. And we know that it certainly impairs potentially memory, right? When you have sleep disturbances or impairment or learning is, I think, sort of the next step in this body of work.
Well, it sounds like you have a lot of work ahead of you here. I'm Dr. Adamson, and I have been speaking with Dr. Joy Huan about symptoms of cognitive impairment in children and their association with atopic dermatitis. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening. Catch you on the next episode of the JAMA Dermatology Podcast.